Hello. The UN Sustainable Goal number 3 is global health and well-being. So we're going to be taking a look at global health and well-being today and the state of health and well-being in China. So this graph here is the life expectancy across different regions, and this is graphed very, very long term since life expectancy has been recorded in some of these instances from 1770 to 2023. And we see, of course, since we're dealing with all of humanity on a multi-hundred year time span, things start to line up and patterns emerge. But there's a surprising amount of disparity between regions given the scale of data that's being pulled from here. So if we take a look at China in the red here, we see a serious kerfuffle, I guess you could call it, in the late 1950s, early 60s, and I think that would be the Great Leap Forward. That would be some political stuff, and disregarding that outlier, it's been a sharp rise for China, outpacing the world average in green here by quite a bit, leading them to, as of 2023, pulling ahead of the world in life expectancy with a life expectancy of 78 years compared to the world average of 73.2. And this is the states up top. You can see we've had a few dips of our own, but we've historically been the leader of the pack in this area. And today, I believe it's 79.3 years compared to China's 78 as of 2023. So that's a pretty good indicator of general health, general human well-being. If people are making it to 78, I think that's a good sign for China. So moving on, let's take a look at government health spending as a percentage of their GDP. And this graph goes back to 1880. I'll cut off some of that back there. But if we look at this graph, we see two clear outliers. We see the United States way up here at 14.3% spending, and China way down here at 2.8 as of 2022. And again, limited data on this one. I discussed in a previous video that it can be tough to get this kind of data out of China. They're not always forthcoming with that, with very broad national health, well-being, GDP statistics, things like that. But anyway, China down here consistently, although we've seen some fluctuation, we've seen a pattern of increase following these other countries. China is consistently way below what we have for comparison here. Some Western European countries, Sweden with their famously good healthcare system, and the United States way up top. So this does indicate a lower prioritization, you could say, of national health and well-being when comparatively so little of the GDP is being allocated to it. But also, it's an important thing to consider that spending and results are not at all correlated, especially when you're dealing with government spending and massive multi-billion, multi-trillion dollar expenditures on a national scale. Um, the process and the the attitude, the philosophy, the inputs, and the structure of national healthcare can have a lot more to do with the actual outputs than the dollar amount you put into it. And we see that in this graph over here. This is life expectancy versus health spending in 2023. The United States is once again an extreme outlier, spending way more than all these other examples. Norway, Germany, Austria, Sweden. These are countries that are known for high government spending, good public services, good healthcare. Here's the United States. We're known for a terrible healthcare system, inaccessible and unsafe and ineffective and cruel healthcare system, I'd say is the general reputation it has. But by the numbers, by the spending, we're way up here at 12,000 per capita. And China down here at 1,086 dollars per capita enjoys a life expectancy of 78.2 years to our 79.3. So certainly there can be something to be said for the efficiency of their system. Now, let's take a look at some GIT solutions to this issue and how they could be applied in China. We have a focus on public health and well-being, international partnerships and collaboration, and AI-driven healthcare solutions. Healthcare is an area where AI is huge. We've seen some big developments in AI in the healthcare sector, and there's a lot of opportunity in the future too. China is another area where we've seen a lot of development and a lot of potential for AI. So, predictive analysis by AI for diagnostic purposes and, and anything from the more data-driven side of things, like diagnostics to robot surgeries or IoT systems in hospitals. There's a whole lot of technological opportunity in the healthcare realm as a high-tech sector. So a lot of application of AI. We need this to be a priority, of course, and we can use GIT to make that happen as far as how information is disseminated and what is coming across the desks of the people that are making important decisions in this realm. And things like information systems and AI technologies can have a lot to do with that. International partnerships and collaborations, big goals like this aren't going to happen on their own. And there's one I really like in here. Um, these two together, data sharing and collaboration through establishing international networks for sharing health data and enhancing surveillance and response strategies. These are two capacities that really got tested in China recently with COVID-19. And, despite some ethical questions in the execution that arose there, um, it was certainly effective. They certainly have that capability. And technology, especially AI technology, has progressed considerably since then, which makes you wonder. But this whole area, international partnerships and collaboration, uh, collective collaborative governance, and collaborative governance models that involve and consider the multiple stakeholders in these big issues should be something that China and the Chinese are generally very proficient in because they're a culturally very collectivist society. They're not individualists like we are. They're a very uh, authentically and naturally collaborative society, and they have a natural inclination to big picture and long-term views of things. So for those reasons, I think we're going to see a lot of progress in the sustainable development goal coming from China, mirroring the patterns we've seen in previous years. So thanks for watching, and I will talk to y'all soon about another SDG.